Hi, my name is Dana Arrington. I'm a student at Excelsior University, and I'm here to present my skills lab for Nursing 105, Week 6, Intermittent Urinary Catheterization. So, I have a patient here by the name of Renee Adams, date of birth 5/25/1978, with no known drug allergies. I have a provider's order for intermittent straight catheter insertion female. If the patient has not voided within 4 hours, use bladder scanner to check bladder volume. If volume is greater than 200 ml, then perform intermittent urinary catheterization. So 15 minutes ago, we went to administer medications for Ms. Adams, and the patient was reported having the urge to urinate but unable to void. Per provider's order, the bladder scan was used, and we found that Ms. Adams was retaining 400 ml of urine in her bladder. So now what we're going to do is we're going to straight cath Ms. Renee to release the urine that's being retained in her bladder. So, let's go over our supplies. I have my Perry wipes here with the expiration date of 4/10/2025. I have my intermittent catheter tray here with the expiration date of 4/30/2025. And I have my sterile gloves here with the expiration date of 6/30/2025. So all of our supplies are intact and safe to use for this procedure. Let's go meet our patient. Knock, knock, curtain closed to provide for privacy. Hi, Miss Renee, it's Dana, your nurse. How are you? Okay, so I have your bladder scan results, but before we get into that, can I see your armband so we can verify your identity? All right. We have Renee Adams, date of birth 5/25/1978, date of birth 5/25/1978, no known drug allergies, no known drug allergies. Okay, Miss Renee. So, what we're going to do is, after we scanned your bladder, we saw that you were retaining 400 ml of urine in your bladder. So what we're going to do now is we're going to straight cath you, which means I'm going to stick a catheter 2 to 3 inches into your urethra, and we are going to release the urine that's being retained in your bladder. Now, the lower half of you is going to be exposed, and the upper half is going to be maintained covered. Remember, I closed the curtain to provide for privacy. Your dignity will be maintained throughout this procedure. Anytime you feel as though your privacy is not maintained or your dignity is not maintained, I will stop the procedure immediately, all right? All right, so now we have to perform period care, which means I have to wash your period area. So I need you to get into position for me, all right? I need you to bend your legs. Great. Let your knees fall out and put your feet together like a lotus. Perfect. So let's perform period care. Right. I'm going to expose you here just a little bit. Okay. So I have my Perry wipes here with the expiration date of 4/10/2025, and I'm going to perform period care. I'm going to start with the labia furthest away from me first. One wipe down, discard. I'm going to then clean the labia closest to me. One wipe down, discard. I'm then going to clean the perineum. One wipe down, discard. Okay. Now that we provide period care, I'm going to now open my sterile gloves with the expiration date of 6/30/2025. And I'm also going to open my intermittent catheter tray with the expiration date of 4/30/2025. Documentation. So now I'm going to open my catheter tray using the aseptic technique. Extra gloves right here. I'm going to grab the drapery by the ends with the shiny side facing downward and I'm going to place the drapery beneath Miss Renee Adams' buttocks. Miss Renee, could you lift your hips, please? Thank you, with the shiny side facing downward. Okay, so now that we've done that, I'm going to don my sterile gloves. Okay, now that my sterile gloves are donned, I have some more extra drapery here. I'm now going to prep my betadine. Okay, put that there. I'm going to prep my lubrication. Now I'm going to take my non-dominant hand and I'm going to place it right here, and I'm going to open both labias, and my hand will remain here the entire time because my hand is now contaminated. So now I'm going to prep the peri area. I'm going to first cleanse the labia furthest away from me. Wipe down. Discard. I'm going to then wipe the labia closest to me. Wipe down. Discard. And I'm then going to wipe the perineum. One wipe down. Discard. Now I'm going to take my urinary catheter, intermittent urinary catheter, and I'm going to place the catheter 2 to 3 inches into the patient's urethra. You ready, Miss Renee? 1, 2, 3. All right, catheter is in. I'm starting to obtain urine, and the catheter will remain into the urethra until the flow of the urine stops. Once the flow of the urine stops, I will remove the catheter. Okay, my flow has stopped. Now I'm going to remove the catheter. You ready, Miss Renee? Are you in any pain? No? All right, 1, 2, 3. Okay. Patient off here. Gather all my items. Wash my hands. And change my gloves. I'm going to cover Miss Renee back up. Miss Renee, are you in any pain? No? All right. I'm going to then wash my hands. And I'm then going to document on the amount of output I received along with the urine characteristics. And I'm also going to continue to monitor the patient's urinary output. And I'm also going to document how she tolerated the procedure. Thank you. All right. Let me watch it.